Since 1983, FAME has helped business and education work for Maine. Contact the authority, the Finance Authority of Maine. You're watching MaineBiz Sunday, Maine's business news source.
Here today to discuss MaineHealth and the larger healthcare industry in Maine is Bill Caron, President and CEO of MaineHealth in Portland. Welcome and thank you for coming.
Thank you, Alan.
Great, I'm glad you could be here.
Great to be here.
We have a lot to talk about today because this is a big topic. You've heard about this topic, right? It's
every once in a while I hear
right.
about it.
It's a huge topic, and of course, especially in Maine, I think. Let me give a quick overview. Tell our viewers who you are first and get a little bio on you. You're an accountant by training and trade. You were named the President and CEO of MaineHealth in October of 2000. You joined MaineHealth as Vice President for Systems Development in 1997. Before that, you were Vice President and Treasurer at Maine Medical Center. Prior to joining Maine Medical Center, you spent 17 years with Ernst & Young in Maine and Pennsylvania. One of those consultants, eh?
One of those consultants.
Good, good. Yep. Master's degrees in accounting from Northwestern University and undergraduate degree from Holy Cross in Massachusetts. So, great,
yes.
Great. So let's get started. Now that's who you are. You tell us who MaineHealth is. Give us an overview of the system, who your members are, how many employees, that kind of thing.
Okay. MaineHealth is an integrated healthcare system here in the state. It's the largest healthcare system in the state. Our service area are the 11 southernmost counties in the state. So we look at southern, central, western, and central part of the state as our service area. Within that 11 county service area, that we have 7 member organizations that are organized around hospital systems. So they're local hospital delivery systems. The largest member is Maine Medical Center, but it includes members out in Western Maine Healthcare, which is Stevens Memorial Hospital, 2 hospitals in Lincoln County, Miles Memorial, St. Andrews, includes Waldo County General Hospital in Belfast, Southern Maine Medical Center in Biddeford, and Spring Harbor Hospital located in Portland and Westbrook. In addition to that, we have 4 strategic affiliate organizations who are also part of the system. That would be the Maine General Health, which is Augusta Waterville, St. Mary's here in Lewiston, Mid-Coast Hospital, which is in the Bath, Brunswick area, and Penn Bay Healthcare, which is in the Rockland area.
Great.
So it's a system that has approximately 9,200 FTEs, full-time equivalent employees, which means from a head count standpoint, there's probably 2,000 or 3,000 more employees from a head count standpoint. We're a fairly large provider of healthcare services. Our local delivery systems include hospitals, nursing homes, home health agencies, physician practices, mental health clinics, those kinds of things.
The whole spectrum of healthcare services. So, about 10,000 employees. You've got to be one of the largest employers. If you add them all together, one of the largest employers in Maine.
We're certainly one of the largest in Maine, and in each of those communities I mentioned, we're, in most cases, the largest employer. Interesting,
interesting. All right, let's talk about just the business side of this first. I mean, you're an accountant. You can put your accountant hat on. So how's the bottom line? How is business from that larger healthcare spectrum business, since, you know, being the largest employer? Tell us how that is.
Healthcare is something that is not immune from a struggling economy. And so we're certainly seeing that in the numbers recently. The way it shows up in healthcare is when the economy starts to weaken, the first thing that we start to see are people canceling elective procedures. So you see the ambulatory volume go down in our ambulatory settings. And then there's a cycle that occurs where people just aren't able to pay their bills. And so the bad debt and charity care numbers in each of our hospitals increases. And so we saw that cycle occur last year, where bad debt and charity care increases, particularly in our community hospitals, the smaller ones, were increasing 20–30% in a 6-month period.
Really?
And so that had a significant negative impact on the profitability of the hospitals. And then more recently, we've seen what I think is the next cycle, which is where you see people, because the economy has not improved, you see people canceling the next level of elective procedures. So volume is down, and in healthcare, that's the bad and the good of that.
Right.
And that if healthcare is down, then that means that people aren't getting as many services. But the bad is if they need services and just not seeking them because they can't afford them.
And you mentioned cutting back on the elective services. Those that are still covered by insurance, those are still being done. So. Well, it's more the elective piece, or
elective meaning where the patient has the choice to do the procedure.
I see.
Cosmetic or I've got a sore knee, and rather than have meniscus taken out, I'm just going to I'm going to work with it and ice it down for a while.
Right. Also in terms of that revenue stream from a business point of view, how's the tighten? Clearly, insurance companies have had to tighten up as well.
They have.
So has that trickled down to your ability to keep those revenues coming in?
It does. Obviously, when people struggle to afford health care premiums, which they are in our state, that puts pressure on the insurance company. They look to the producer in this case, or the provider network in this case, and so they're looking for greater and greater flexibility on our standpoint as far as the amounts they're going to pay us.
Yeah, I'm interested too. I mean, it's interesting. I mean, you're the CEO of one of the largest sectors in our state and one of the largest ones in our state. And I know you talked to a lot of other CEOs who aren't healthcare CEOs, but other industries. How is managing a major healthcare business different than other businesses, and how is it the same? Especially now in this economy.
Yeah, it's different. I'll do the different first. It's different in the sense that the hospitals in the state of Maine are not-for-profit hospitals. Every hospital we have in the state is not-for-profit, and so we have an obligation to provide care to people in the state of Maine whether they can afford it or not. So there's no way to shut off those that can't afford to pay. In some industries you can do that. You simply self-select, and you don't allow those people to purchase your products, or you don't make those products available to the consumer. In our case, we need to make those products available to the consumer. So that's probably the key difference, but it's the not-for-profit versus the for-profit side of the business. The similarities, a lot of similarities. We need to focus on making sure that we do remain profitable. If we continually lose money in a period of time, we're not going to be able to provide the services that we need. We are a business ourselves. Our largest expense, other than salaries and wages, is probably healthcare expense as well. Right. So we're very similar to many of the other employers out there. Okay. And you use a lot of the same supplies and all those energy and all the same things that other businesses would as well. So, we do. Okay. Yeah. You also use workforce too, the same kind of workforce. Yours may be a little bit different as well, but that same pressure is on. We know that according to Maine Hospital Association, 34 of Maine's 39 hospitals have had some reductions this last year, 300 layoffs in the hospitals. Has MaineHealth experienced that? Have your members been experiencing that? And talk to also about, because it's such a contrast, because actually this is one of the fastest growing, only growing segments in the state. We'll throw this chart up that shows that, really projected over the next 3 years, it's the only area that's really coming out of, we're having job growth right now, and it's going to continue to outpace the rest of jobs in Maine all the way through the projected 2013. So how are we doing with workforce? Are you finding the people you need? Did you have to lay off, and can you find the people you need? As over the past 18 months, each one of our member organizations has had to do some things to reduce costs related to the workforce, and so in a few settings we've done layoffs, and so several of our member organizations have had to actually cut staff. Our strategy really, though, has been to maintain as many people as we can in the workforce, because, as you say, we have a constant need for workforce, and so our fear is that we lay someone off, and then 6 months later, volume returns, and we can't bring that workforce back. Right. And so our strategy that we've adopted, whether it's right or wrong, is to look to our existing workforce and ask them to accept less in salaries and wages. And so, as opposed to layoffs, in many of our organizations, we've seen some reductions in salaries. And in almost every organization, we've seen a deferral of annual salary increases. Okay. We're going to wrap right there for this segment. We're going to come right back, though. So now I want to talk a little bit more about the workforce issues and recruiting doctors, those kinds of things. So hang on. Stay with us. We'll be right back.
Mainebiz Sunday is brought to you by Bangor Savings Bank, where you can enjoy free ATMs worldwide.